Welcome to KIMEcast, where we break through and cut the BS in sports medicine, rehabilitation, and sports performance, and talk about how things really work. Welcome to KIMEcast. Russ Dunning and Tony Mikla. So we've been talking a little about this return of live education back to, at least to our space in the world of performance and physical therapy, and it's super great. It's super exciting because we're typically like hands-on people. We want to get involved and actually do stuff and be live with the situation. So it's great to have this education come back from all that crap that was going on before and having everything to be online. So this is super exciting for us because we're wanting and have been live very, very successfully in the past with some phenomenal fun groups. We're really wanting to get back into that space as well. We're putting together some things. We've been running this high performance director certification program in-house with our team, which has been outstanding, and we're looking to build that out to the world. We were actually just in Rome 6 months ago and presented in a very similar fashion, and plan to go back, putting something together for the European market as we speak. So this is something we're putting together. We want to talk about, as we were just brainstorming, what is it, now that this is kind of coming back, and what is it that we should include in this type of education for a performance coach, for a physical therapist, for even a massage therapist, chiropractor, athletic trainer, somebody who's in this high performance sports team environment. What is the content they need to get through, or what's missing in their existing education of what's out there, you know?
Yeah. It really kind of comes down to what determines greatness when it comes to sports medicine or high performance. So we have the performance continuum that lays out our buckets, the buckets of motion, stability, strength, speed, power, and then performance. I say performance is kind of the wrong word to some degree, because performance usually means the sport. Are you throwing discus? Are you racing? Are you racing a 100-meter sprint? It's usually like, what's the outcome? What's the score of that sport? Everything is leading to how to enable sports medicine and performance training in that realm. So it's, I think, on a simple front, like, how do we determine elite knowledge in each one of those buckets? And what are other subsets of knowledge that allows you to be elite in that space?
Yeah, I think there's the basics, right? You got, as you said, we got pain management, range of motion, basic strength. Like, that's classic PT 101. I mean, I think we've done great stuff in there with our Bulletproof series in the past, and I think those are things we'll continue to touch on and grow with, but we want to really raise the bar to, like, what else is missing. So those are big forces, and there's secondary strength where you're actually starting to build the body and build the tissue and build up tolerance to load and hypertrophy and some of these other neurological components as well. And then, of course, there's speed, power, and explosiveness, and those are areas that I think there's a lot of information out there, but maybe it's not. I don't think it's usually integrated in such a way where it's part of a return to sport type of progression. And there's a decent amount of debate out there in the high performance community as far as working with athletes, teams, whether it be individuals or team environments, and training to high performance, how you load and how you grade that. There you see all kinds of things. If you're training football, we see a variety of high performance loading strategies that are a little different than you would see in other sports, so to speak.
Yeah. I think that's the thing about sports, is they usually deal with a lot with tendon injuries and fascial injuries. So it's a lot of it's the soft tissue strains, and when you're looking at your typical physical therapist, definitely, or your typical clinician, needs to restore normal movement, stability, and strength. But can they help you accomplish elite level motion, stability, control, strength? Elite level to me is, can you embody the motor control of a gymnast? If you had a gymnast that was a level 10 gymnast, can you get them back to the degree of movement that they need for their sport? If you're thinking of stability, can you help a professional NFL lineman tolerate the impact that is needed as soon as the quarterback says hut? If it's in the strength world, can you help the rugby athlete get the thigh strength needed to be able to handle the scrum? So you have to think of what is the most elite version of that bucket, and do you have the brain to take someone in that? Because I think a lot of PTs say, oh, I get back full motion, I know how to do that. But unless you take someone from a herniated disc, they blew out their back, the L5 disc herniated so that the person shows up to your door your clinic and completely laterally shifted to the left. Can you help that person get back to grappling another human like their life depends on it in the octagon? Now that's a feat. It's not just, can you rehab a back? Oh, I've done that before. Can you rehab an L5S1? Oh, I've done that before. Mm-hmm. Can you get that person back to better than they were before?
Yeah.
At an elite level. And so even in the basic buckets, it's pretty hard.
In a chaos environment.
In a chaos environment.
I mean, that's a big thing. Yeah, agreed. So, some of the things we've identified that I think will be paramount to include in a programming like this. I've spent so much of my career in this high performance. I find that there was a big lack of time under tension type of training or control, if you will, around joints, right? So there's always been series for the shoulder, for like a throwing shoulder, of doing the jobs or doing standing letters or prone letters and such, and doing them from repetitions. But we always see them performed terribly, frankly. They're always really fast, and they're not getting very good out of it. And despite the cueing, despite the coaching, you really got to stay on your athlete to slow them down. So one thing we changed in this environment was to go for time, like hold it for a minute. And there's a lot of good science around why to hold things for a prolonged period of a minute. There's changing mitochondrial activity, and that 1 minute time where cells start to produce more efficiency to use oxygen as a fuel source, and we see that start to change at that level of hold time. So that's a really, really big one, and we also see it around tissue stability, where we see other forms of chemistry as well as the patient's or the client's ability to kind of hold something for a long period of time starts to really become shaky, neurologically starts to fall apart a little bit in that time window as well. So we changed that thing. That's something we all want to teach about, is how you do that for the upper extremity, how you do that for the spine, how you do that for the lower extremity, and what are the progressions of those steps are a great thing that we've done in the past. I think another thing to really touch on, to look for here in a program like this, has to be, that's localized tissue conditioning, but has to be more of global conditioning as well. I mean, I think this is the biggest maybe mistake or overlooked area, if you will, probably not mistake, but overlooked area in return to sport work, is the conditioning of the athlete.
And I think that's for a simple reason. Most high school coaches, or if you're influencing an athlete that's 16, 17, 18, and they haven't been severely injured yet, you have been riding off of their sport conditioning for the last 10 years. They've evolved in that sport to an elite level athlete just by simply playing the sport over and over and over again. And then as you get old enough where severe injuries start setting in, say their ACL, UCL, meniscus, spine, something gets severely wrong and deters them for 6 to 9 to 12 months. Now they're coming back probably in somewhat of a deconditioned state. So how well do you bring them back to where they were? Because I guess it's safe to say that the varsity coach probably does not understand how to get someone from a conditioning with a conditioning program from, say, 30% to 100%, but they might be very good at helping people get from 80% to 100%.
I'll give you the example today. Just had it this morning. So we got a kid who's kind of a long story, but unfortunately was terribly mismanaged with an elbow injury. He's a thrower, plays quarterback, also plays baseball. Had a stress fracture in his elbow that became a bit more than that. Terribly mismanaged by the medical people, by the doctor, by previous PTs. Everybody said he'd be fine, just do this, just do that. And he did what they said for about 3 months, and then went in, started throwing, blew it back up, blah, blah, blah. So he came to see me about 8 or 9 months into it, and I told him right out of the gate, I said, I don't think this looks good. It's been too long. You're lacking extension. We've got, moving valgus is positive, overload's positive. We've got some inflammation problems. 9 months later, it's not good. It was middle of the season. He wanted to continue to play. I was like, well, I'll tell you what, we can give it a shot. Give it 4 to 6 weeks and see if we can get over this hump, see what happens. But if 6, 8 weeks goes by and we're not better, then we need more information. I need to get you to the right people. And when it comes to the elbow, you got to go see. There's 4 or 5 guys in the world to go see. So the throwing elbow, at least. So we did that. We got to that point, and earlier in the process, I was like, hey, we need to take the next step. And they were very, very hesitant to do so. The young guy he's 14. He's a freshman in high school. So he was really hesitant to want to get bad information or negative information. So anyways, we got him there, and sure enough, stress fracture evolved into a larger fracture. And when they went in there, did surgery, it was hanging on by a fragment. So blah, blah. Screwed it back in, got things locked up. He's doing amazing. So we're about just over 9 weeks out right now. So things are coming along really, really well, doing a lot of strength. So we just had this conversation. I'm getting him back to join the football team with lifting, and we've been doing carries, we've been doing weighted holds, nothing into a push-up or like where he's having to dynamically move through the range. But his football coach is like, they've seen him injured for a year now, again, due to the mismanagement prior. Now he's back in the weight room, feeling better than ever, feeling good. But yeah, of course, you can't do Olympic lifts, you can't do power cleans, you can't throw anything, you can't do anything jerky or explosive. But as far as hold strength or sustainability, we're quite good. And so I told him, I said, I want you to get back in the gym. I want you to be doing deadlifts. I want you to be doing carries. I want you to be doing back squats. I want you to be doing front squats with your arms crossed as opposed to racked. And he's like, yeah, I got it. I've been doing it. He goes, my coach told me that I can't do anything with the team because they've seen me hurt and he's afraid to have me be hurt again. And I'm like, no. No. And I was aggressive with him. I'm like, absolutely not. He's like, so I've been going to the gym and I'm in the corner kind of doing my own thing. And I'm like, no, the worst thing that can happen is that you sit in the corner and you kind of mildly load yourself. And then at one day the coach says, okay, it's now time to go.
It's been long enough.
You've been cleared. It's been long enough. And then you launch. Like, that is the worst thing that we could possibly have in this situation. It needs to be a progressive loading over time. That's how your body changes. So you tell him exactly what you can do.
Yep.
I'll write it down for you, and then go do it. Like, right. Maybe you're not going to load the way that the other kids do or as aggressively, but you need to get in there and be working.
Right.
And you need to be failing.
Right.
In these movements, in these safe ways, because otherwise your body's not going to adapt. Plus all the hormone release of you lifting is going to have such a positive response on your tissue healing. That's what we need. Going dormant as an athlete for anything more than a day is a terrible situation, much less 6, 8, 12 weeks. I mean, holy moly.
You are speaking to, I do think the perfect word is conditioning, and a similar word is also capacity. But it is the joint structures capacity, it's the ligamentous capacity, it's the connective tissue capacity, and not just at the elbow, of the entire body, right? And I think that cannot be overlooked of how to try hard in safe ways. And I think this high performance specialist, this certified sports medicine at an elite level, understands that you have to load in progressive ways safely through the process. So said in another way, if you don't have at 2 months post-op or 3 weeks after a severe injury, if you don't have them understanding how to safely load their body, you are completely missing it. And I think that's a big, huge part of it. Yeah,
there has to be a programming component to this development, this education development, where there's a solid programming of how to load, how to get the tissue to adapt, considerations in inflammatory periods, considerations in high levels of weakness where there's been, like in this case, there's been unloading for 9 or 10 months, the reloading process and how long that's going to take, and understand how that adaptation curve could work. And then there's got to be knowledge. We've talked about this all the time. There's got to be knowledge of like what's best practice, what's the elite level of training look like in a normal environment for the normal athlete of this space. Like if it's a quarterback on a football team, what does the best in the world look like? And then start breaking that down to be like, how can I add these components? And for me, that's one of the things that's helped me the greatest in my career is working with an athlete is what is the best for an athlete and what you do, where you're at in your career, or even best in the world. And then how do I build the blocks of that so I can get you into that spectrum?
So the phrase I'm thinking when you say that is reverse engineer. You have to reverse engineer what elite looks like. You know, whether it's the 16-year-old football athlete or the collegiate sprinter, you have to know what elite looks like for that person, and then reverse engineer their entire life and programming, everything from nutrition to conditioning to what does the shape of their body look like, what does their grip need to be, what does their balance need to be. And if you are heavily delayed on programming a person after a severe injury or severe trauma or surgery, and you're delayed in improving all factors of what elite look like, then frankly you just have a bigger mountain to climb. You know, for that elbow patient, if you didn't squeeze anything for 3 months while they're healing from a UCL, and you say the elite level thrower needs to have a grip of 150 pounds, then imagine starting from 30 pounds at month 3. How long does it take?
Yes.
To program someone from 30-pound grip to 150 pounds.
That was the conversation today. He's like, I've been starting deadlifting, and he goes, my grip gets tired before my body does. I'm like, exactly. That's why we're doing it. Because you staying around doing stupid grip exercises is not transfer to the level we want it to. It's a start. It's rehab 101. It's a start. But you've got to like actually be able to hold that bar for a lot so that you could eventually load your legs or the rest of your body to do the things you need to do in football. Otherwise, you're going to get hit in August and get killed out there, you know? So, as you said, reverse engineering, I totally agree. So, do you think it's appropriate to include, like one thing we've done in the past is like maybe a case or an example? Because if you break up athletics, right, you have a few movements. You have throwing things, basically. You have throwing things, you have kicking things, you have sprinting, you have change of direction, deceleration, change of direction is kind of the same category. And then you have, if you will, jumping or like vertical horizontal force production. Those are kind of like your big activities: running, throwing, kicking, jumping. So breaking out those mechanics, reverse engineering those mechanics, and then building programs for each of those pathways.
Yes.
Is that part of the curriculum?
I think
is that a test?
I think when you say that, it sounds like a lot. Because that means the practitioner needs to understand the mechanics.
Well, they do.
Of each of all of those, this is daunting.
Yeah. Well, hence, you don't get to high performance by doing easy shit. I think that's the whole thing. Like, so we've done that in our coursework. Usually, I have them pick one, but I also wonder if them having to master each of these is truly what it means to be, certified in this space. And I think that's the direction to go. Is that you have to understand loads. When we're doing this course within our own group, we're doing this a lot. We're having a thrower-specific session. We're doing a running-specific session. We're doing a change of direction-specific session in an effort to really dive down that rabbit hole of load management and what's the progression of here's basic easy things and here's more a little bit harder, a little more difficult, a little more challenging, back to reactionary activities, then back to competitive play.
Yeah. Well, it is. I feel like you really have to be a biomechanicist to understand all of the kinetic linking involved in those patterns, and then you also need to be a programming scientist to understand tissue load and recovery. Yeah.
No, I like that. I think that somehow we have to incorporate that, and whether it be like a test or assessment at the end or something to turn in some sort of work. I honestly think from a certification standpoint that should be appropriate versus this garbage certifications where, hey, I attended the course, I'm certified. So I think that's interesting.
Well, I think going back to like kinetic linking, someone can have great power. So say their vert is say 24 inches on a force platform. It's a pretty legit vert, but they can do it in a shitty way. So it's one thing to kind of judge the outcome. They got a great vert. But then we can also maybe judge the spring, or you can judge the reactive strength index of what's their flight time to ground time. We can look at their minimum displacement upon the jump. So there's quite a few things with jump that get interesting to try and qualify how good is someone moving, which is interesting when a force platform can tell you how good you move because it's not using video.
So a sports science component. Which would be, force platform for all athletes, and then maybe even some other variables of throwing, looking at velo, looking at spin rates, looking at some of these other variables that are specific to throwing, that are performance metrics, similar to like a 40-yard dash or a 60 or, a three-cone drill or something for the lower extremity. I like it. One of the component that we've had that I think is a critical one is how you communicate. Is building buy-in, if you will, or building engagement. Because it's one thing to have all this knowledge, information. You don't want to be a sports scientist and be a nerd and not be able to talk to your person, right? You got to be able to understand it, compute it, look at the data. Then you got to look at the athlete, look at where they're at in the process, understand limiting factors, understand where they're going, how much time you have to get there, and then actually communicate it in a plan.
And that seems very difficult because you know better than I do. So go back to like NBA where they have like the data scientist manager, and then they have the emotional, influential assistant coach leader. The hype man and the data man.
Right. True that. Yeah, so then in a professional organization, you'll have a high-performance director, like who's in charge of the whole program. They'll look over performance and they'll look over sports medicine and rehab. And then depending on where the athlete is in the process, they'll get both. They always get both windows. It's just a matter of which one gets loaded more, where the time is spent based on the acuity of the injury. But as they're going through the rehab process, the performance coaches are working with them, and then the performance coach starts to get more and more of the load. And then, of course, there's nutrition, and of course, there's maybe sports psychology. And then the third element that's usually not under the performance director's direct control, but certainly has lots of communication and meetings, is with the skill coaches. So the skill development guy, it will be an assistant coach, which would be responsible for that player or that athlete's specific skill set acquisition to do what that team needs him to do at different points in the game. So say if you're football, you're a defensive line, you might have your defensive line coach is going to work on lots of footwork and skill drills and movement drills, so that when they go into with the defensive coordinator and in the scheme of the defense for that football team, you have a certain job to do, which might be containment, might be to rush the middle, might be to occupy a double team and take two blockers with you so that the next guy can get by and get through the hole. So all kinds of strategies. Same thing in the NBA or in basketball would be, can you drive right? Can you drive left? Can you finish at the rim? Can you shoot and move quickly? Can you get to the paint and kick? Can you do these things which require specific footworks and movement strategies, which can be trained in the rehab and sports performance environment, which is usually our job as high performance, is like, let's get the athletes so they can do that job really well. Then the skill coach can be kind of integrating that into the actual practice. And they're usually more of the rah-rah, if you will, a little more of like, obviously let's do it well, but let's get excited about it. Let's have some fun with it. Let's look at percentage of accuracy. Let's look at those variables.
So, well, you mentioned all that. I think the word I zeroed in on was sports psych. Obviously, the game of influence and communication is also a component of really understanding psychology at a deep level. So, I think this high performance sports medicine individual needs to understand a healthy degree of how sports psychology works, how habit formation works, how does neurology work, both at the brain level and the peripheral level. And that's, I think, critical, not just critical for making money in this world and being able to relate and communicate, but also appreciating everything that your athlete has to be able to do and how you're going to coach that. And I have seen, we've talked with more doctors, there's Dr. Herman lately at UC Davis, and then a few other interesting insights as to how to implement cognition with training. That's a subset that's, I think, very, very gray. You have any thoughts on that? Should we be implementing a little bit more of a cognitive test?
Yeah, I think it is interesting. I think I've seen it in practice. I've seen there be some successes. I've seen there be some failures and a little bit too much. I think it depends on who you're serving and where they're at in the process. No doubt the cognitive side and the subconscious side is, at the end of the day, everything, right? It's everything. However, if there's not trust in the body or the body part, or if the conditioning isn't present, so if the joint doesn't work or the conditioning's not there, or the strength or the power's not there, then I don't think no matter how much cognitive work you can do, you'll be there.
Yeah, it's kind of a fake brainwash. Won't happen.
Yeah, so I think certainly the icing on the cake, right? You got to build the cake first and get everything set and established, build the foundation, and then this should be developed in the process. And I think resiliency is a big process to build in the process, a big part of it, where for the first time, most likely, especially of an athlete, that this is probably the first time they're down, especially for months, 1 month, 4 months, 6 months, 9 months, whatever the time frame is. It's a long time to be down. So there's a lot of work to be done in that period. But always the athlete emerges stronger if they have the right mindset. So I do think there's a mindset component during the rehab process, and there's the basics of inspiring hope, and then there's the details of what steps are you going to take today so that you're better tomorrow, and what are we going to do this week and next week and the following week. There's got to be a planning process. It's very, very clear there as far as getting your body right. And then I think the confidence that athlete can take into their body, into their skill development, I think is massive. So there's a piece of it there. But this idea of really, reaction to sport, game time decisions in fatigue situations, critical thinking, and it really comes down to what we consider to be reactionary, the speed of which it happens. Definitely can be trained. We had some really cool stuff that we used to do
at Athletes Performance that was awesome, where we had quarterbacks. And, I don't know how well it actually carried over. I mean, it's hard to really justify, but some guys liked it. Some guys thought it was annoying and just kind of got a headache. But we had a big TV screen. It was like 60-inch screen. They were in this black room. It was really a neurologically like deprived room. So it was just all black, dark, just with the screen in front of you. And there was quarterback training. There was visual acuity, and we were working on their thought process to take a drop. And then when they took the drop, they would have to like read the screen of what the defense was doing. So you'd have a pre-snap look of the defense, and then you have a, right at the snap look, and then you might get a post-snap look while you're taking your drop. And so the length of your look would be like, anywhere from 0 to 3 seconds. So if you got a 3-second look, then you'd be able to see pre-snap, be able to see the snap, and then you'd see a couple steps into your drop. You'd see the defense move, and then the question was, what are they in? Are they in cover 2? Are they in man? Are you getting a blitz from the weak side? Are you getting what is the defensive line doing? And you had to make a read because, of course, especially at the elite levels, the defenses are masked, right? Mm-hmm. They might be in zone, but they're going to make it look like a man, and then vice versa. Sure. And they run these obstacles and stuff to try to throw off to make the quarterback make a bad decision because he gets a pre-snap read, then in his head he's thinking, okay, I'm going there, and then that's not going to work. This is what makes Tom Brady so amazing is that he could read it pre-snap to know exactly what was going to happen, so that guy was almost always open because he knew what was happening because he could read it so well. So that was kind of the art, was to develop that skill set, long story short. But I think it's there. I think there's stuff on this topic of developing the brain. There's developing the sense coordination that's interesting. There's the glasses out there on vision training, which I think are interesting. Again, if we go to that's the priority over getting the rest of it up to speed, I'm not sure that we're targeting the right thing. Yeah. But if you're at the tip of the spear, you're up at the top of your pyramid. I mean, you're the Patrick Mahomes.
Maybe you're there.
Yeah. Maybe that's. I think that space is a space to play with. Yeah.
Yeah.
I would also tell you that if you're at the tip of the spear, you're probably already doing it.
Sure. Yes. Yeah. I remember when I had the second best fighter in the world. Unfortunately, he didn't get the belt, but he got knocked out pretty hard, so shattered his entire face. And he had a concussion that lasted the better part of 9 months. So he had a constant headache, and he had really poor vision tracking. So we would do a lot of ocular motor training. That was one of the first times I really got deep into like using Cyclops training. So we put an eye patch, and then I would throw the ball in different ways, and he'd just work on a lot of clever like turns, 90-degree turns, up and down, rolling. He would constantly be changing his head position, changing his eyes, closing, open. And I'd give him one eye, give him two eyes, and then we get into a balanced position, always kind of like hand-eye coordination, foot coordination. The hard part about doing that is it's always difficult training. So it's kind of hard to ever feel like, oh, I'm so much better today. It's kind of hard to create this like perfect battery where you timed it and somehow they did this battery at this level and to retest and the battery's better because it's kind of a custom battery. As soon as able to do something, I make it harder. So I'm always on that edge. So although I appreciate that type of, whether it's ocular motor work, whether it's doing math or trying to make decisions, I appreciate it. It's hard to create a battery. It's hard to create a test. And if you can't create like a distinct test, it's hard to train for it. And then if you can do it, at what time point? Because it's probably not more important than bone remodeling, tendon remodeling, neurological remodeling at the more motor control stabilizing parts of it. There's probably other things to do that help build confidence and allow the person to kind of get back into a sport environment safely, that then they have to make the decisions with the sport.
Yeah. Yeah, agreed. I think no doubt there's this reactionary component to sport that I think is commonly underdosed and needs to be part of the education process in high performance. Is, can you get an athlete to react at the pace that needs to be happening in the sport, which is insanely fast? Like, we drastically underestimate game speed on a regular basis in a clinical environment. There's actually no way you can replicate it, honestly. Like, it's not possible. So anyone who says that it is, it's just wrong. It's just not possible because the intensity of a game situation, the sounds, the lights, those sensory stimulus, you just can't simulate that in a game-like environment. Not to say you shouldn't try, because you should. You got to push the envelope, but realize you're still always going to fall a bit short. But there's some great stuff, and like that, we've seen the lights. Like we use the Blaze Pods, and you can do some stuff with those that are kind of cool, where you can set up reactionary drills and stuff. But touching lights isn't a sport, right? But it's the right idea. The question is, can you simulate load where if on a lower extremity person, if they're at a knee problem, can I simulate that, hey, you're going to run to the left and then you have to respond and cut back to the right and plant off that foot and twist and do something you don't really feel comfortable doing or didn't in the past? Can you get to a point where that becomes automatic for you and as fast of a reaction time as you used to have? And I think that can be measured, that speed can be measured. And there's you don't want to train reaction, in my opinion, until you've trained speed. So you have to get speed first, doing like a 3-cone drill, doing like a pro agility where you know the outcome. And then it's like, okay, now let's do the reaction where you're having to like react to a shadow. Doing some shadow drills is great. The light drills can be great. Things to make the athlete react and change. So they have to get speed of contraction at high force in a game type of environment. Competitive type of environment is what we're shooting for, so that the athlete can trust. That's what shows up in all of the literature. Over the last 10, 20 years of like rehab to sport is like, they pass all our mechanical metrics, but one thing that's missing is this psychological component where they don't trust the limb. Mm-hmm. They don't feel like it was normal until 18 to 24 months later. Mm-hmm. It's that's disturbing. Mm-hmm. There's definitely a piece that's been missing. I think that's part of the piece, and then there's also part of it that we can't hold them out so long and deprive them of practice and getting on their feet and getting out in the game situation that they build up an absence, like, or a lack of control. Mm-hmm. Like the best ECA I ever rehabbed, the guy did amazingly well and went back far earlier than I would have recommended as a professional MLS player. He was a keeper, but he went he went back at just over 4 months. And everything about that rehab was abnormal and was against what the protocols would say. It wasn't the wrong stuff. It was just much faster. But it was based on his tolerance, what he was doing, and even at the clearance time to go back, it was a bit rushed due to a professional environment of tryout, and it was his own interest. He was trying out for a different team and really wanted to go and felt like he was ready. And, we took a shot because it was at the right time of his career, but that was an appropriate choice. And, he was comeback player of the year the next year, so it worked out, and it was awesome. But I think that's we were doing a lot of reaction stuff and minimizing risk really, really quickly in the process and in a safe environment. So that's a big part of the deal.
I mean, we're living with the duality. If you're overly conservative, you almost create like a version of PTSD.
Yes. Yeah,
you create a mental space where they learn mistrust. So to some degree, the faster the better, because the brain, you're not having that much away from the sport where the brain adapts, and they might not ever return at a high level again. And then if you go back too soon, then bad things happen. I think that's the natural dichotomy of this, which makes it so interesting. But as you spoke of all the different buckets, which we've said them in words. We're talking about them more in detail in terms of conditioning and speed and reaction. What I think is so critical for the listener to understand is that there is a hierarchy. If you try and get strong before you have good slow tension stability at a proximal segment, the body won't let you. It'll have a governor, a built-in governor. Mm-hmm. And it is trying to get strong with a push or a pull and having a weaker cuff by even 10, 15%. It's smart. It won't let you. And the same thing can happen of trying to improve a lactic power or anaerobic power. It won't let you if there's not a good aerobic health local in the tissue and in the heart and lungs. You can't get the training cycles you need to get that elite power. So there is a hierarchy. There is an order that we find. And if this high-performance specialist doesn't understand that hierarchy, you cannot coach someone from zero. It's easy to take an 18-year-old that hasn't gotten hurt yet. That's easy. To take someone that's been injured and they're now starting from a very low spot to recreate that and take it as efficiently through that battery You do have to understand the hierarchy. You have to understand every bucket, how to program each bucket, because you're identifying what is an elite level measure for where that person's going, whether it's varsity or college or pro.
Yeah. Yeah, I think the greatest example of this that we have in sports is pretty consistently demonstrated with the UCL stuff is, the athletes come back better than they were in many, many cases, which is outstanding. Like, it's very, very rare that we see that in the sports medicine space, like the people are actually better than they were, and it's fairly consistent. The numbers are really strong that people come back in a better space, and there's a lot of debate as to why that's the case. I think you have a really nice match of medical expertise. The guys that are doing the UCL reconstructions, the 3 or 4 guys in the world that do an outstanding job here and do a majority of the work, have really nailed down a phenomenal strategy, medical formula to get that ligament to heal and hold. And because it's not an active contraction tissue, it does amazingly well. And then the rehab process around this is such a dynamic process of systems that we just spoke of to get the athlete back, that a couple great things happen to consider. Like, the athlete does take a long break. So, speed is usually not a focus here. It's usually pushed off significantly, 6 to 18, 24 months even. The longer is becoming more common, the more the 18-month window, which is a long time for an athlete to be down. Psychologically, I'm not a big supporter of that, as we just spoke of. I think it's a long time. It's harder to come back from that. So, but now you're not doing nothing during that time. You're doing a lot of stuff. But I've always had really good success in the 9 to 12 month range with folks, unless there's an outlier or a reason not to. But it's big in the beginning. Do the basics, build strength. And we think that maybe the reason why these athletes do better is that for the first time in their career, they were good enough to tear their UCL, which means they're probably throwing a reasonable pace for their body size. If they're in a college or pro level, they're probably throwing well over 90. And they've done it enough times that it finally failed, and that just seems to be kind of something you almost earn. There's very few guys that make it to the big leagues that have throw hard, don't do it, don't tear the UCL. So that means that the person's been good enough to get to a high enough throwing velocity and skill level that they actually earned themselves. So they've been doing it for probably 10 years. Maybe they started at 8, maybe they started at 10, whatever. But by the time they hit 18 or 20, that's usually when we kind of see these injuries be a pretty predominant issue. Well, now they took a year off, and they got to really think about it. The first time they did not throw all season.
In a decade.
Yeah, exactly. First time they're in a decade, because they're usually throwing in season, they're throwing off season, they got a pitching coach, they got a catching coach, whatever. They got all these other things that they're always throwing. Even if they're take 2, 4, 6 weeks off in the wintertime in December, whatever it is. I mean, yeah, maybe kind of, but probably not really. Whether that's good or bad is fine, but at no point are they able to focus on their body like they are during that period of time. And it's usually a perfect maturity window between 16 and 24, where their body's primed, ready to you give it some feedback, let's load you and let's train the body. Holy shit, it's gonna change. It's gonna adapt and change. Really quickly. In 6 to 12 weeks, you're gonna get an amazing, you're gonna get 15, 20 pound change in a guy. So you see that. So they get so much stronger. They get so much more confident in their body. Their arm is starting to heal. And then they learn this whole arm care program of how to take care of their arm in an elite way. And they get their mechanics dialed in. And this whole time, there's no pressure of any kind to go perform. They're just working on their body. And they really shift their mindset to wow, if I take care of myself, what's possible?
And they might up their front squat and RDL. And they get this stronger torsion through their body, through their hips and their core. But it is also unique. It's throwing. So throwing is fairly predictable. They know they know the pitch. They know what their hand position is. They're repeating something over and over and over.
It's less reactionary.
So it's quite different than really anything regarding the lower extremity, particularly in the field or court environment, where they have to react to an infinite amount of stimulus.
If you don't have to react, you don't need an ACL. So you can run straight ahead with no ACL. You can jump with no ACL, which is the landing is a little bit tricky, and the deceleration is tricky. And if you get more in a reactionary sport like tennis or basketball or soccer, you're smoked because you can't react. So that exactly, your great point is the predictability of that may lead to why that's more successful than others. Would be an interesting idea.
going back to the point that if you're doing anything with lower extremity, whether it's the hip, the knee, the ankle, any type of reconstruction, and you're starting from a very low space, if you don't really help facilitate that improvement of understanding reaction in a very safe environment, slowly building that speed up, you might be missing the most important component of rehab. Granted, knowing our performance continuum, this is after you've done basic speed, to your point.
Yeah.
Do basic speed and then test reactionary speed. So it does make me think we probably need a stronger battery to test reaction speed.
Yeah, I think it has to be a component to be looked at, which I think we see like in sports science, like we have the repetitive jump, like we're looking at
the single leg RSI, right?
Yeah.
The reactive strength index, I think, it gives us, to some degree, something of how well you can react to a stimulus of landing on the ground.
Yeah. But on that topic, we have to be very, very careful about the new sports science coming out. You can't just say like, oh, we're going to do RSI. There's a significant amount of data suggesting, depending on what test you do, that's a relevant measure. Yep. Asymmetry is a very difficult measure. You have to be really sensitive to what test you're doing and be really consistent with your test setup and your battery there as well. So we're talking about a repetitive jump, single leg repetitive jump, 4, 5, 6 repetitions, and then looking at RSI variance amongst the group.
I think it's a huge concept. I spoke with Dr. Lauren Green. He's a phenomenal researcher out of Hawken Dynamics and does this type of sport testing for a living. And what he always speaks to is noise. Is there too much noise in that data point? And if it's too noisy, if it's not reliable, if there's not good either intra-relator or intra-tester reliability, or just even the test, how much do you understand what you're testing? Does it test what you think it is? And we can even use the words of we're testing stability, we're testing how quickly you can react. Really? Are we doing that? And so he asks really smart questions in this space, and he's helped us define what our renewed battery is. But we've changed our battery every year for the past 10 years because we keep getting rid of the fats and trying to improve. What are we even looking at here?
Yeah, what are we looking at? And what does that test tell us what we think it tells us? Is it legitimate, or is it fraudulent? Is it like, oh, we thought it tells us that, but it actually doesn't really tell us that much?
I learned this with the triple hop. I had this kid who unfortunately didn't do any of the programming despite my constant influence into him. He had a knee reconstruction. It was a fairly lengthy reconstruction. He was non-weight bearing for 6 weeks. And he's a super stud athlete. He was maybe 1 inch taller than me and can dunk with ease. So he had a phenomenal vert. At 5'11", he was getting, elbow to rim. I didn't know. It was incredible how this kid could jump. And after he did his knee rehab, he had a smaller quad. And so I kept motivating him, but, like, hey, I want you to be able to pass these difficult tests. And he could never pass my squat test. Never. I humbled him so quick. Once his knee got to 90 degrees, it completely gave out. But I tested him with the triple hop, and he passed it beautifully, 100% both sides. And then when he asked if he can try and dunk yet, I said absolutely not, because your knee's not strong enough. And then he flipped around as like a wise ass. He flipped his phone around and said, well, check this out. And he dunks. And it is a perfect tale of how the body will find a way, a performer will find a way. But without smart testing, he still has a problem. We know he has a problem. Yep. He can't decel on that knee. He just finds ways of cheating the test. So it goes back to the triple hop, which we've held as a standard for a long time. A lot of doctors see the triple hop as a good test for post-ACL. Well, he proved to me that test is worthless. That's when that showed to me. Like, you can look at the research and, there's 5% that it might not capture what you think it is, because it could be a hip dominant mover versus a knee dominant. Whatever the case is, whatever data you want to say, he proved that test is meaningless to me with a great adapter.
Right. All depends on the athlete in front of you. That's why the battery of tests is important. That passing one, failing one, who's in front of you and what's the situation. Looking at this larger conglomerate of tests and like bringing them together as a group. They have a name for that. I can't remember what they call that, but bringing them together as a group and looking at it that way is got to be critical. But it is interesting how we've tests that we put more weight into years ago are now like gone, and other ones that like were everything, like this whole knee situation against Isokinetic using a Cybex, that was like was everything and has been everything for like 40 years.
Mm-hmm.
The machine hasn't even evolved.
Mm-hmm.
You can still have the machine from 40 years ago and it's equally as effective as it is today, I think. So it's always been something like clinically we're like, that's not real because no one has one.
Yeah.
I've never been in a city where I've had one within 100 miles of me, you know? And certainly not had one where I had access to it to be able to send a client there and get information that was valuable. You know, so I've modified different things, like trying to use Kaiser equipment or using different kinds of equipment to try to get this, or now the dynamometer. And like now the force plates is really nice. It's a really nice way to get good data. It's still not quite the same, but that is stood the test of time as being a nice stable. We know that depending on your force production throughout that test, your re-injury rate does seem to be low. So there is value in it for sure. I've never been a big fan of it because I don't feel like it transfers to sport movement to do an isolated seated kicking motion like that. However, you know, can't deny the effectiveness of the test. I
think that's a big part of it. I think people can easily mistake a test for an exercise. Sometimes the test becomes a great exercise, many times not. I think this is one of those cases. I've had plenty of people pass that test with flying colors and have never done the exercise.
Yeah.
And so, you know, for the learner, we kind of fall prey. Oh, to get good at the Y excursion, you do a whole bunch of Y excursion. To get good at jumping, you need to do a lot of counter movement jumping. Not so, actually. There's difference between what training looks like, what performance, what plyometrics, what strength, what movement, what stability and balance can actually look like that pulls people in the right direction. With just, you know, whether it's reps, sets, and volume and intensity, whether it's some variability day to day, whether it's creating something that pulls people with the right program, because we can't underestimate a little bit of diversity, a little bit of variability, but then a constant improvement of movement skill. And then having a test being a clean test that we can operate at scale, we can make it reliable, and to showcase our problems. There is a big difference between having a smart battery and then what good training looks like, and they don't have to be the same. But I'll say with every learner, if you've never done a counter movement jump with your hands on your hips, you're going to learn really quickly, like, oh, that feels a little bit different. So you kind of have to be skilled enough to get rid of the skilled acquisition of, oh, I just got better because I learned how to jump with my hands on my hips. So there's a little bit of that.
Yeah, 100%. You always got to neutralize that learning curve with the process. But with an athlete, it's like fun too. I mean, like, you know, we tested a NFL quarterback the other day and looked at him. You know, he was like, we did the test and he's like, "What's that? What's the number?" You know, like, the number's this. He goes, "Okay, I'm going to beat it right now." I'm like, okay. And then we got to a point where he couldn't beat it. You know, he's trying to beat his RSI, he's trying to beat some, you know, his load variables and some of these things that he couldn't overcome because it was truly measuring his, you know, his
spring. He was trying to improve his spring. He goes, oh, 0.9, I could do better.
Yeah.
I'm going to try 10 more times. That's your skill right now.
Yeah, that's what his tissue is trained and able to do. So it's like that's not something you could do right now. But with the right training program, we can influence that. We can change that number, and we can have some impact on it. But it's going to take you a little work over time with very, very specific training load.
Well, I think sometimes, you know, things can be fun. I mean, frankly, jumping on a force platform for a lot of athletes is fun. Even doing a pro agility 5x5 is fun. I'll tell you what's not fun is doing the mile run, doing a sled push, do a 5-minute all out, and taking any type of, you know, blood draws through that process. And so I do think the science that's been coming out with the metabolic carts, how improved those metabolic carts are becoming for anyone to kind of have their own little cart and then do some pretty advanced like metabolic testing. And I wonder if that should be stronger with us. You think it should be a good test for embedding this battery?
I just had this conversation the other day with a young man who was actually in an interview process of applying for, you want to be an exercise physiologist and was looking to join our team. We just had this conversation about actually looking at VO2 max and some of the metabolic, you know, lactate thresholds and on RMR and these different metabolic things. And I told him in the conversation, I'm like, depending on who you're working with, you know, I mean, I think what we've seen as far as like, you know, due to capitalism and what's sustainable, the people that are typically interested in that data are going to be like your distanced people, you know, your endurance athletes, your triathletes, you know, maybe your long-term cyclists, probably less so, but certainly your distance runners. But it's really an elite level of competitors. Like your Ironman people are into it, but like your recreational marathoner or like your Olympic distance triathlon people, less so. You know, your Spartan race people, less so. Although all of them could benefit from the information and could customize training programs to be better at it. 90% of the competitors in any of those things are just doing it as a weekend warrior thing, and just because they're a badass, they want to be more of a badass, so they're just out getting after it. And in my experience, they're rarely focused to really like carve it down and be like, okay, this is my life. I'm making money in this sport. This is my career. Now, that being said, huge factor. Like, the question would be, do you need all of the data in that list?
Or how much of it?
Yeah, how much of that is going to really make a difference? We trained a downhill skier this summer. I trained the skier this summer who just went through her season, and we looked at VO2, and we did do the metabolic cart testing. And she was below a 36, and then we were looking. We over a 6-week period, we wanted to improve that. We improved it to just over 40, which I thought was pretty good in the time period that we had. And she's a high school athlete. The important thing for that was to improve her recovery, because she's in a school that's a private school, and so she does it all remote. She's in an academy's environment, so she literally like flies from Missoula, Montana to like Anchorage to Jackson Hole to Tahoe to Mammoth, and back to Colorado and Utah, Park City, whatever. So it's like every weekend's in a different venue, for like 12 to 15 weeks, So her ability to fly, compete, recover, the VO2 was interesting to me, even though the race lasts 1.5 seconds, right? At best, hopefully less than that. So it's like VO2, I think, is a good recovery metric. And if you're dealing with an athlete that needs that type of recovery, then I think it's interesting. If you're playing enough basketball or enough soccer on a weekly basis that you could be fatiguing your system out and therefore having a performance impact, then VO2 would be a factor. Then you have to say, like, what the hell are you going to do about it? Are you going to take that athlete, like a basketball athlete or a soccer athlete, and have them go run more, or have them do more training on top of that? Or are you going to try and push their lactate threshold off? So, like, what does the test give you outside of their ability to recover? I think there's some variables there, like, hey, you don't have very high VO2 and you're playing a sport and you're competing 6 days a week, or you're practicing 6 days a week. Your body's not going to do that very well. You're at risk.
I think the challenge there with looking at VO2 is higher is not always better. Each sport kind of has its sweet spot, as well as your ability to tolerate lactate. What's your power output when you are in a fatigue state, and where is the lactate level, and can you continue to produce power? As we know, some athletes with maybe more of a medium level VO2 can actually can operate in a lactate environment very effectively, as just judged by their just will, their will to push and their will to grind, and their body's ability to survive in that intense acidic state. So I think it's hard as you find the numbers. What's the goal? And that's really, I think when we're injured, we can say, let's get a little more aerobic. Let's develop some lactic aerobic capacity to handle a training interval and to handle performance. But as you kind of get deeper down that pathway, it's hard to say this is what you need to be for majority of sports unless you're purely in an endurance sport. So it's hard.
Yeah, I really like VO2 as a look as to how well someone recovers, that's for sure.
But the watches are doing that, right? Your Garmin right there.
Yeah.
There's some hint at that of like,
I think
probably heart rate variance.
Yeah, I think HRV is probably gives you some variability there. I think just if you monitor your heart rate, I think there's a lot to be done there as far as your overall health goes, and I think it can be a precursor to identifying an illness. If you're getting sick or something, like your heart rate goes up. I think that those are some things we can attune to a little more now that we have those devices.
Well, that was our old battery, right? And maybe that's just the best battery of looking at what's your training heart rate, what's the heart rate recovery post, and then what's your resting. We did that, and I think you could pick like a jumping activity or a sled push activity or even just a run activity, maybe just depending on what type of activity is your sport. That's not in our current battery, and I'm debating. I
think it's important from a healing standpoint. I think there's impacts of VO2 on healing. I mean, it's how well do you use oxygen to create energy in the body, right? So there's impacts of that on healing. There's the heart rate then is important to like how stressed is your body, right? And if it's dealing with, we talk about this all the time, if there's more components of stress, your rate to heal, your rate to grow and improve are going to be diminished. So I think they're definitely factors, that's for sure. I think there's other signals you could be utilizing. So if you don't have a metabolic cart or the use of a metabolic cart, I'm not sure it's worth the time it takes to set it up and to test it, and the error rate that you're going to have, because you're not going to do it super often, I don't think, and it's blah, 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 blah. There's many other ways to get that.
Heart rate
other
monitor.
ways to get that data that you could, I think you can extract for a majority of environment. Mm-hmm. Now, if you're at the tip of the spear and you're really at high performance, and you're talking about, improving someone's, performance by 0.01 seconds, or really looking tip of the spear stuff, then 100%. And I think every piece of information you can gather and interpret starts to become important.
Well, this speaks to other buckets. You just mentioned a whole bunch, but if I were to kind of put collectively in this space, I would say everything from your basal metabolic rate to are you fat burning, carb burning, to your VO2, resting heart rate tolerance, and heart rate training capacity. And in this space, we might also got to like how long can you hold your breath for? Mm-hmm. How long can you exhale for? And this does speak to cardiopulmonary, mitochondrial density, and the breath mechanism, and then specifically to your overall recovery, and then that floats right into sleep and nutrition. So we got some huge buckets and a lot of books to read and a lot of podcasts to follow to really kind of speak high performance.
Yeah. No, think about it. Yeah,
it's a lot.
It's a big deal. Hey, I mean, look, we talk about like how do you influence a person, communication, talking, inspire hope, being positive, understanding their sport, and how to communicate to them in their sport and their environment and season, timing, all that good stuff. Obviously, can you manage their inflammation and can you get them through the acute phases of rehab and such? Do you understand programming and how you can really load someone over time and truly, manage many variables of that? Is it hypertrophy? Is it endurance-based loading? You're trying to get chemistry of the tissue. What kind of triggers you're trying to have without getting ridiculously fancy, but understanding what's out there so you know how to like dumb it down for your person. Understanding your sport biomechanics of the movement, with the movement biomechanics, with the sport biomechanics, and then how do you coach to modify and help someone achieve better biomechanics if their biomechanics are perhaps risky. But you have to be careful with this. Very, very careful with this. So, that's usually not our space to like change biomechanics, but we should know what they are, know what ideal is, know what your athlete presents with, and then determine, where exactly you want to, where you want to go with that. And then you get into the cardiovascular development, like we've been talking about. I mean, there's so many components to this, and then reactionary training, sprint, change of direction, all those components. I was at this event with the U.S. Olympic Committee, and it was a high-performance meeting. This was well over 10 years ago, maybe 12 years ago. And the director of high performance, one of the presidents of the USOC, got up and he asked a question to the group essentially through his presentation, which was outstanding, one of the best presentations I've ever seen. And the presentation was, of course, on high performance. And have we reached the threshold of human performance? And he showed many Olympic numbers as far as how velocity in the 100 meters has, went up, and then it's basically had plateaued for
inflection point.
Yeah, exactly.
Diminishing returns.
Yeah, so a lot of diminishing returns. And since the 60s, we went to the 80s with the drug and all the drug work, and we saw the highest human performance. And then in the 90s and 2000s, it was just kind of level, right? And so the question was, have we reached the edge of human performance?
With jump, with sprint, with swim, with endurance, with the mile.
Yeah. Is incredible, and it was good. And then the second part of the presentation is, and this is the greatest line: what matters when everything does? Which is exactly what we've been talking about.
We just talked about a long battery.
Yeah, everything's out there, right? And I think that sometimes with an athlete, we've seen that we've not reached human performance at that time, 12 years ago. We've seen guys run faster. Since then, Usain Bolt broke the record for the 100 meters. And we've seen sustained high performance in many events. Greater. The Americans have come in the shot put and set world records since that time, beating numbers in the 80s, which is insane. So we're seeing that we were not at the edge, and in fact, that we have pushed human performance to a higher level. But I think that we have to be careful that you don't turn your athlete into a science project.
Yes. I think it's a big one because you start messing with really what makes them great, usually in a sport environment. You're actually not thinking too much.
Yes, they just naturally are there, right? And it's about fit in many times. You look at the greatest to ever do it. Like whether it be Tiger Woods or I don't know, like I say, LeBron James is the greatest. I'd say Jordan's the greatest, but we could talk about that another time. But certainly elite and player of the decade, if you will. You name it in any sport. Djokovic in tennis, whatever it is. Like these guys that are like truly move the needle, they're just naturally like the perfect frame, like the perfect body, the perfect mindset to do what they did when they did it with either the team or individual performances around them that allowed that to be possible. There was a natural thing that happened that you have to let unfold. And if you turn your athlete into a science project, you can, depending on the athlete, you can really overwhelm them. Whereas Lance Armstrong, for example, maybe the greatest cyclist of all time, loved science.
Yes.
And he really, really embraced it. And everyone could say, well, he cheated, but everyone else did too. I mean, that was well known for that time period. That was what you did to be in the top 1% of the world, was to compete in the way that they did. So it's, but he was into it.
Yeah. Well, you speak, I think you speak to the natural insecurity that's in a lot of clinicians and people that are in, this industry. Is the insecurity brings out something in us that says, I need to prove my worth. So I'm going to prove my worth by looking at all these things and talking about it and trying to basically revel in how smart I want to be for you. Look how hard I'm trying for you. And in it, we kind of create almost like a head case. Like, oh my gosh, I got to get better at all these things. Versus having a voice of confidence and calmness and focus. We're going to do this now. What next? What next? I have a plan. Don't worry. Let's focus on this workout right now. This is what we're doing. And if you can simplify this massive battery of things to just one singular thing in this moment, I think now you are a high performance specialist. You're taking a battery of information that's in your head that you understand, and then you're influencing the person with their singular priority right now. Maybe there's 2 and 3, but the focus is on one. That's hard.
I totally think that's it. What's the limiting factor that's going to actually move the needle, and get the athlete engaged around, hey, I can move that and I can do it. And certainly start there, then you can start chipping away at other things as the process elongates and continues. But continuing to show holes in the process or show them what they're bad at over and over again is not necessarily a recipe for high performance.
Yeah, some of my best athletes, the athletes are worth, many times into the multi millions. I don't mean to show off. It's just like when they're worth that much, they ask questions that are worth a lot of money.
Yes.
And I got someone with a brand new hip. They resurfaced his hip, and he's worth a lot of money. And so when he asks a question, he's asking with a lot of weight. And he's like, well, what about this and this and this? And it takes a shitload of confidence to say, don't worry about that. We're doing this. Focus on this. I can't tell you that it creates a stressor in my brain that says, oh, how certain am I about that right now? Yep. I have to think through the whole battery. I have to think through everything we just did.
Yes.
Motion, stability, and conditioning, and tissue. I have to double check. And sometimes I double check my work a little bit vocally with them. Other times I think about it and say, nope, this, for these reasons, our focus is here.
Yeah.
And when you're doing that, when their entire sport is on their life, if you're dealing with a 15-year-old ACL, this is their whole world. Their whole identity is wrapped up in their questions to you about, when I get back to soccer, can I do it at this time? It is their whole life. Or if it's the 18-year-old where their college scholarship is depending on their ability to do this.
Yep.
And so the weight of it is incredible. And if you talk a whole bunch of gibberish about all the sports science we just talked about in front of a patient, you're proving your worth, but you're also proving you don't know how to prioritize.
That's it, 100%. Yeah, you have to be able to answer that question. If you haven't seen it before, you don't know, that's okay too. But then you have to give the athlete confidence, say that we're going to put you through this plan that we're creating, custom for you and your situation, based on their experience, and I'm going to have you prove to yourself that you'll be ready to answer whatever that problem was that you asked me about. Like, hey, we'll be able to load it and do these certain motions or whatever. Well, I'm going to put you through a battery of things to make sure that you can do that, right? And if you can't do it, we're going to know why exactly you can't do it, because you're going to fail in a certain way. And then when you do that, we're going to fail safely, and then we're going to build we'll build that strategy at that time to get you where you want to go. But the answer is yes, we'll get you there. Yes, we can do this again, because I'm going to prove to you, and you're going to prove to yourself that you can do it over this process. That's the most fun thing about this.
That's it.
But you definitely don't want to give a false sense of like, oh yeah, everything's going to be fine. That may not be the case, but you could suggest that we will get there, and we will do so through this scheme. And if we do hit a failure point, we do have options B and C that we can choose from. But at this point, this is the path forward.
Confidence in that hierarchy, confidence in that battery, confidence in what you can do if they don't meet a certain threshold, where those thresholds exist. Because I'm definitely not one to say don't do any bit of C until they pass perfectly B. That's not the way to go. If you don't do some low-level conditioning and some safe strength while you're working on focus mobility, the tissue just downgrades. And I think that's the interplay. How well can you balance a few balls in the air at once while still having a priority one and keeping them safe and keeping them focused, but still putting some positive work so you influence biomechanics and you influence tissue healing?
What you said there, I made me think there's another component to this high performance aspect, which is network. That either when shit goes awry, or it's going great, or you have a problem and it's like we need a solution. Like, I need to know people that can solve this problem. I need a surgeon in this space. I need a great sports medicine doc that's maybe great with injection options and what our potential is there with stem cells, PRPs, other strategies to manage pain, inflammation, whatever it is. I need a nutritionist. I need a massage therapist. I need a chiropractor. I need to have a network of people that are somewhat at my disposal, but at least on my team, that I can say like, hey, if we do hit a wall, we're not done. I have, these. We have people to go to, or we can answer that, get that question answered. If I get into the right guy, get into the expert in that space. That's a colleague, that's a friend, that's an acquaintance.
That really is. That's wrapping it all up with having a village, having a community, which really goes back to the insecurity. If you slough off the ego out of this whole craze and have passion with what we do, then this actually happens naturally, because you just ask more questions and you appreciate when good people around you have smart answers, and then you align. Yeah.
That's a simple way to say that. That's exactly right. Well, you have a lot to do, as do we. And develop.
Well, it's a career. We have a career here. Is what we have.
Exactly.
It's not a job.
Yeah, and it's for us. It's obviously about doing that well. So, if you guys have other suggestions, other things that components that make up this high performance role, and what it is that we do, how we serve it, how to educate it, let's share. Share it on here. Post in the comments. Reach out to us in that way. We'd love to talk about it. I'd love to hear it, because we're putting together kind of phase 2 or a higher level of our high performance certification program. So we're looking to kind of make this best and make this fit for what the needs are, and what you guys want to hear, what you guys want to see, what you want to learn. Thanks for listening.